Once again, welcome to the Kūpuna Network. My name is Dr. Russell Kim, and I'll be going over dental products that I would recommend for all of my patients, and particularly for the Kūpuna. Now, when you go to the store, go to Long's or you go to Safeway or any of these stores, and you look at the dental product line, there is a long line of stuff that you can choose from. So I just want to give you a few tips that hopefully will help you pick the right products for yourself. So first off, what I like to do is talk about your toothbrush. Now, with your toothbrush, they still sell the firm, medium, and soft toothbrushes. Now, I recommend not getting the firm because the firm can actually damage your gums and damage your teeth as well. So don't buy the firm. The medium as well, I wouldn't recommend it. That can still do the same thing. Damage your teeth and damage your gums. Always go for a soft toothbrush. This is the kindest for your teeth and gums, and is the one that most dentists recommend for everyone, and in particularly for our Kūpuna. So the other thing that I would recommend for Kūpuna is an electric toothbrush. Now, there are different kinds of electric toothbrush. This is an Oral-B electric toothbrush. In fact, this is my toothbrush, the one that I use every day. And why I like the Oral-B, dental research shows that it is probably the better one to use, although I do have people using other products, Sonicare as well, and have great results from that. But what I like about this one is that when you turn it on, it tells you if you're brushing too hard. And so when you brush too hard, the red light comes on. You see that? And so it will tell you if you're brushing too hard, and the action of the rotating head allows you to easily get in between teeth, and especially back teeth. There's a timer on it as well that tells you to brush for at least 2 minutes. And so this you can get any store. Costco has these as well. And so I'd recommend for most Kūpuna, having an electric toothbrush would be the way to go. Okay? Now, for cleaning in between your teeth, there are different ways that you can do that. Flossing is still, I recommend, the best way to do it. And you can get traditional floss like this that's very thin and very easily gets between your teeth. And you'll be able to floss and it won't shred. Another floss that I've recently been using is called Cocoa Floss. And that's this one right here. And when you open it up, why I like about it, the reasons, is that as you're flossing, it starts to unravel. And that unraveling allows these fibers to come out, and it does a really good job at flossing the plaque from below your gum line. So flossing is still the gold standard that I would recommend people that can do it. If flossing is hard and you can't do it, there are other things that you can do. There are these floss picks, soft pick, that you can go in between your teeth. And they got a variety of different kinds. Gum makes a lot of them. There's these straight ones, there's these curved ones that can go in between your teeth. What I don't like about these is that it doesn't lend itself to going in between your teeth as well as a traditional floss. But it's better than nothing, and especially if you have receding gums, these work really, really well. They do have, you can buy these, and I do see these a lot, where the floss is actually attached to a little device here, and people do it in the car while they're watching TV, and you can floss your teeth this way. What I found with these, and there's a little pick on the end that you can go in between your teeth as well. What I found with these is that people don't have a hard time flossing the back teeth. And so they floss the fronts pretty good, but the back teeth, they have a hard time getting in there. And so these are kind of limited in that way. Another kind of flosser is these one with the handle. Sorry, I didn't open it. But these handles with the floss angling at this angle versus the side angle, like these are. You can see the difference here. This can get in your back teeth a whole lot better. Okay? and these are working really, really good. Kind of going back to the toothbrush a little bit, when to change your toothbrush. You don't want to wait until your toothbrush looks like this. Okay, you want to be able to, you want to change your toothbrush. It can be a month, it can be 2 months. Anytime you see this, that's the time to change it. Okay. For those that have, again, have a hard time reaching in your back teeth, there are these small-headed toothbrushes. These are called an end-tuft toothbrush. Now what's good about these is that it's a smaller head than any of these toothbrushes, longer bristles, and you can get way behind on your back teeth a whole lot easier. Especially if people have wisdom teeth, these work really, really well as well. Okay? Now as far as for dentures, I have a denture here. There's these denture brushes that you can get. And these work really well at scrubbing the insides of your dentures, scrubbing the outside. And so people that have dentures or even partial dentures like these can work really, really well. Some people use their toothbrush, which is fine, but because these are harder, you need a little harder bristle brush to go ahead and clean these. So what I'd like to share with you right now is how to brush your teeth. So for brushing your teeth, you can see this better. What you want to do is when you're brushing your teeth is brush right at the gum line of your teeth, and you're brushing it going back and forth this way. And what you're doing is that you're not only cleaning your teeth, but in some instances, really is more important to brush your gums. Most people, when they brush their teeth, they brush the tops of their teeth, but don't really brush their gums as well. And that's where we really want the brush to get to take care of gum disease. So on your bottom teeth, as you're brushing, really get in there. We call it at a 45-degree angle into your gums, and slowly go around your whole mouth. And for your top teeth as well, point it right at the gum line and get in there and brush your teeth and scrub it in there. If you're using an electric toothbrush, this makes it easier, where you can just point the brush right at there, and you see how it turned red? You don't want it to go there. And you can slowly move your brush around this way to brush in there. Okay? And then after you're done brushing and flossing, you want to go ahead and brush your tongue after that. That will help any bad breath. Well, bad breath bacteria we know sits on your tongue, so when you brush your tongue, that will help eliminate bad breath. Now, for toothpaste, the main ingredient in toothpaste that you like to get is sodium fluoride. The reason is sodium fluoride helps to keep your teeth strong. Now, Crest is the one that everybody knows and has a good track record for having fluoride in your mouth, in the toothpaste. Sensodyne is a stannous fluoride product, and this is really good for sensitive teeth. People that have sensitive teeth, I recommend using Sensodyne, and that helps eliminate the sensitive teeth. Another one is the Complete Care for Arm & Hammer. And the ingredient in here, besides sodium fluoride, it has sodium bicarbonate. It's kind of like baking soda that's in here. And that will help to eliminate mouth acidity. And by eliminating mouth acidity, you help the teeth not only stay healthier, but you don't allow the bacteria that likes that acidic environment to flourish and cause cavities. Now, Waterpick, I recommend also it's kind of replaces flossing. And what's good about it is that when you use this, the water that pumps through the tip can flush out all the bacteria in between your teeth, and therefore eliminating the bacteria and limits or it decreases your chances of getting gum disease. And these are for people who have a hard time brushing or have a hard time flossing. By using this, it just makes it so much easier at home to keep your teeth clean from in between your teeth. And a lot of this, it's easier I recommend going to see your dentist, and they can show you how to use all of the products here. And a lot of times you really need to sit down with your dentist or your dental hygienist to go over the details on how to properly use these products. Okay, thank you.